Hello friends, I am Shaurya Mishra. Welcome you to your own YouTube channel Vision Care Advisor. Friends, today we will discuss the uses of stenopic slit. In this video, we will discuss what is stenopic slit, what is the principle of stenopic slit, what is the procedure of the stenopic slit, and why do we use stenopic slit to find out the axis of the cylindrical power. Whether we have better techniques to refine the axis of the astigmatism like retinoscopy, Jackson cross cylinder, and also we are using the autorefractometer. So let's get started to understand the technique of the stenopic slit. Friends, let's know what is stenopic slit. Stenopic slit is a black disc with a thin slit and it is 1 mm to 2 mm in width. Stenopic slit is mostly used to find out the axis of astigmatism. It is coming with all the trial set of the box. The slit should be longer than the interpalpebral aperture, that would be between 1 mm to 2 mm in width. The length is variable but should not be less than the average diameter of cornea, and it would be between 15 mm to 35 mm in diameter. So let's know the principle of the stenopic slit. The principle of the stenopic slit is based on pinhole effect. It is nothing but a series of pinholes kept side by side. As the basic principle of the stenopic slit is pinhole, it improves vision in ametropia by rotating the disc of the slit at different angles that can change the retinal blur image size. It is more useful to find out high degree of astigmatic axis in patients who have poor vision due to the astigmatism. So friends, now come to know where can we use the technique of the stenopic slit. If you are not able to find out the axis of the cylindrical power by performing the retinoscopy because the patient having irregular astigmatism or unclear media of the eye, stenopic slit technique is useful for the patient who have small pupil, lenticular, corneal opacities, and irregular astigmatism. Friends, let's know the procedure of the stenopic slit. Firstly, record the distance vision, then occlude the other eye. If the patient can accommodate, so do the fogging technique by adding plus 1.50 diopter sphere in the given estimated spherical in the trial frame. Then start doing defog by adding minus 0.25 diopter sphere to find out most plus power accepted. Then put the stenopic slit in the trial frame at 90 degree or 180 degree and note if the vision improves. If the vision does not improve, rotate the slit till the vision is sharpest at a point. After confirming that patient vision is improved at a point, for example, if the patient says that the vision is clear and the slit angle is at 120 degrees, then axis of the cylindrical power would be 120 degrees. After finding the axis of the cylindrical power, add spherical lenses over the stenopic slit till best vision is reached. This spherical power using the stenopic slit will be considered as the power of the cylindrical. It means whatever the spherical power added over the stenopic slit would be your cylindrical power. Thank you for watching. Stay tuned for more updates and don't forget to like, share and subscribe. Please do remember to check your vision yearly and see the world clearly.